Welcome back, everyone. From dry, flaky skin to eczema, winter weather can do a number on your skin. Here with tips for treatment and protection is board-certified dermatologist Dr. Janiga with Janiga MDs. Thanks for your time.
Thanks for having me.
There are lots of benefits to winter, but it sure does a number on your skin. What is the number one thing we can all do to protect our skin?
So number one is still wear sunscreen in the winter, and that's the kind of piece of the puzzle that we all forget.
Yeah.
So a moisturizing sunscreen for the face, because the second thing is moisturizing. Because our skin is so dry, the environment takes all the moisture out, and the humidity is sucked out of the environment from the heaters in our homes also. So we have a double whammy effect there. So moisturizer, and don't forget your sunscreen are the two.
Which I don't do either.
Yes.
That's part of the problem.
Yeah.
Let's talk about flare-ups with like eczema, psoriasis. You know, is it worse usually in the winter time?
So 80% of patients will have a worsening of their eczema in the winter, and 20% will have a worsening of their eczema in the summer. So everybody is a little bit different. But for the people who are cold sensitive, the wind takes a toll on them, and then the cold, and then that decrease in humidity that we talked about. So they can have a lot of struggles in the winter, those people.
Sure. And for people who may not know, what is eczema?
Eczema is a condition that you are genetically predisposed to, and some people never get it until they move to a very dry climate, like Reno. But if they lived in Baton Rouge, Louisiana, for example, they probably would never see the effects of it. But it's a inflammation of the skin that causes redness, dryness, flaking, and itching.
Wow. Okay, so hot baths.
Yes.
We should avoid them if we have sensitive skin.
If you have sensitive skin and you find yourself having itchy spots and eczema, one of the things you can do is decrease the temperature in your shower so that it is tepid instead of very hot. You can also decrease the length of time that you spend in the shower, and use a gentle cleanser on the body, except for what I call pits and parts. So you can still use the antibacterial soaps in those areas, but then try something a little bit gentler on the rest of the skin.
Pits and parts. All right, if you take nothing else away from that.
That's right.
Pits and parts. Just focus on those. Okay, and let the natural oils everywhere else do their work.
Correct.
Okay. All right. Dr. Janiga, she's the greatest. Okay, thank you for being here.